Hi dear friends, today I'll be talking about migraine. We know that migraine is a common condition. Okay, patients who have this condition have usually been told that they have this migraine, right? Sometimes their concern is that there may be a more dangerous condition, right? Such as brain tumor. Most of the times we don't find such things, but the concern is genuine and has to be addressed. Sometimes headaches are caused or increased by such concerns, right? So getting an answer to this question can even relieve the headache, and it's an important thing. At least the severity and frequency can come down. So one thing I get asked is, doctor, are you sure this is migraine? Or how do you know? Are you sure that this is migraine, right? So first things first. There is no test to confirm migraine, right? I cannot put you in a machine and get the answer, unfortunately. Yeah? So migraine is diagnosed in a stepwise fashion. First of all, you rule out any other condition, which means the first question to be asked is there any brain tumor? Many people also worry about developing dementia or an aneurysm. They have heard this somewhere and they know how deadly that can be. So the first question is a brain scan necessary, right? Now there is a general guideline which is wisdom gained from experience. That is that at some time in the lifetime of a person with headaches, they should undergo at least one brain scan. This is born out of the experience that occasionally somebody has been treated for a long time and only after many years it was discovered that they actually had a brain tumor. Most of the time such tumors are benign, like meningiomas, slow growing tumors that don't pose a threat to life or health, at least not initially. But having said that, this does not mean a scan should be done every year or frequently. Some people want it done every year. I can understand the anxiety, and the concern is not that there will be radiation exposure if it is done only once a year. The deeper issue is that the person has an anxiety, and that may be impairing their life. Now, for some simple common sense points, okay? Let's say you or someone you care for has consistent headaches, which means there is some frequency, about once a month or once a week or several times a week and so on. And let's say this has been going on for more than 6 months. Then it is more likely that this condition is a migraine or similar migraine-like conditions. So duration of illness, the frequency and the pattern are important. They allow us to reach to this conclusion. Once we know that there is no other life-threatening condition, it is easier to come to such a conclusion. There are many other issues. Could it be sinusitis, a tooth disease, or an eye disease? Now I'll address this separately. Things become more complicated as we consider all the other different things. And it is important to keep things simple. And one way to do that is to take one thing at a time. Most importantly, not to be overwhelmed by anxiety. A little of anxiety is okay. Sometimes it is good because it makes you take action. But too much anxiety, like anything else in life, can impair it. So the take-home message is headaches are common. More commonly, they are migraines or something similar. And the best thing is they can be easily identified. That's all for today, and I will discuss more in detail in future videos. Thank you.